So you've just been prescribed Prozac. Now what? Should you be worried it's going to cut down on your personality? When does it kick in? What are the side effects? If you've asked any of those questions, you're definitely not alone. Prozac, also known as fluoxetine, is one of the most prescribed antidepressants on the planet. And if your provider chose it, there's probably a solid reason why. But what does it actually do? What should you expect in the first few weeks? And what's the real deal from someone who prescribes this stuff every day? I'm Dr. David Danish, a double board certified child, adolescent, and adult psychiatrist who's prescribed Prozac to thousands of patients. Let me walk you through what we actually see, what works, what's tricky, and what to keep an eye on. Fluoxetine is part of the SSRI family. That's selective serotonin reuptake inhibitor family. All that really means, it helps boost serotonin levels in the brain, which can then improve mood, anxiety, and even energy over time. Here's what it's officially FDA approved to treat at the time of this video recording: major depressive disorder, obsessive compulsive disorder, otherwise known as OCD, panic disorder, bulimia nervosa, bipolar depression when it is combined with olanzapine, not alone. And one thing that sets Prozac apart, it's approved for kids as young as 7 or 8 for OCD and depression. That's rare in the SSRI world and the antidepressant world in general, and we've got good data behind it. And now, off-label benefits: social anxiety, generalized anxiety, post-traumatic stress disorder, premenstrual dysphoric disorder, and other symptoms and other disorders. Those are ones that are not FDA approved, but lots of psychiatric practitioners, including myself, use Prozac off-label for those conditions because we know it can work. So, how long before you start to feel better? Most people don't feel instant results. You might notice improved sleep, focus, or fewer emotional ups and downs in the first 1 to 2 weeks. But for more meaningful symptom relief, full symptom relief, it usually takes 4 to 6 weeks and sometimes up to 12 weeks to see the full benefit. Keep an eye out for early signs it's working. Might be improved sleep, a little bit more motivation, a little bit more joie de vivre or enjoyment in everyday life, and just feeling a little bit more emotionally steady, less stuck or overwhelmed in daily life. A lot of times your family members or friends may notice it before you do. All right, let's get honest about the side effects. No scare tactics, just real world stuff. So, some common early side effects, these usually do fade. About 15 to 20% of people, in other words, 1 in 5 people, will have stomach upset. It might be nausea or loose stools. That same percentage may feel a little fatigue or even a little restlessness in week 1 or 2. Either starting it or going up on doses can bring these side effects on. Okay, side effects that can stick around long-term: sexual side effects like lower libido or delayed orgasm show up in 10 to 30% of patients. So less than 1 in 3, but still it can be a fair amount of people. Unfortunately, these do not always go away with time, and they can be dose dependent. Okay, for this set of side effects, call your provider and consider stopping the medication immediately. If you feel way more anxious, agitated, or start having darker, more depressive thoughts, especially in the first few weeks, such as suicidal thinking, that may be a sign it's not the right fit for you. Okay, the extremely rare side effects, well under 1% in most cases. Serotonin syndrome, usually only a concern if you're mixing it with other medications or supplements that work on increasing serotonin. Manic symptoms in people with bipolar disorder. This should not be used as an antidepressant in patients with bipolar unless it is paired with good mood stabilizers. In patients who may be developing bipolar or have a high family history risk of bipolar disorder, it may induce manic symptoms in those patients just as any antidepressant may. Allergic reactions like a rash, swelling, trouble breathing, God forbid, all those are possible with any medication. I've not really seen those too much with Prozac, but they do exist. And lastly, we need to talk about the black box warning. If you're under the age of 25, Prozac, like all antidepressants, may slightly increase the risk of suicidal thoughts, especially early in treatment. In big studies, this happens in under 1 in 132 people under the age of 25 who start an antidepressant. So it shows how rare it is, but it still can occur and should be monitored closely. Okay, let's talk numbers. Dosing. Prozac comes in both capsules and tablets. The capsules come in 10s, 20s, and 40 milligram doses. Tablets come in 10, 20, 60 milligram doses. They also have a liquid option, which comes in 20 milligram per 5 milliliter solution concentrations. Starting dose for depression is usually 10 or 20 milligrams per day, depending on the age of the patient and how prone they are to side effects. Usually, the maximum dose for most disorders is 80 milligrams per day in teens and adults. In some treatment-resistant cases, especially treatment-resistant OCD, we may go above that, sometimes going even up to 160 milligrams per day. For depression, other kinds of anxiety, that usually is not done. One of the really great things about Prozac is that it has a very long half-life, which means it stays in your system a long time compared to other medications. Because it is broken down so slowly, some people actually end up doing very well with every other day dosing once they're stable. Also, if you happen to miss a dose accidentally, it's not as big of a deal compared to other medications that have a shorter half-life. Okay, here's how I think about Prozac after years of prescribing it. It's one of my top 3 go-to SSRIs, right alongside Lexapro and Zoloft. Why? It's long-acting, which means if you miss that dose, it's forgiving. That makes it great for people who occasionally forget, and a lot of my patients fit into that category. It's also more activating than some other SSRIs. If you're dealing with low energy, low motivation, that activation can give a boost that's helpful. But, and this is a big one, for patients with panic attacks, insomnia, that kind of activated anxiety, that same energy activation or energy lift can feel like too much. Those folks usually do better on something a little bit gentler. So in my practice, who's a good fit for Prozac? Teens or adults with depression or OCD, patients who need a little extra energy or momentum, patients who sometimes forget to take their medications on a daily basis. It's probably not a great fit for people with sleep issues due to sort of that activated anxious thinking at night, or patients with intense anxiety. Bottom line, it's a powerful tool, but no medication is perfect. We still have to fine-tune it to you. If this helped, subscribe and check out drdaviddanish.com. In the Mind Vault, I've put together 2 great resources related to this video, and one of them is a cheat sheet of what we just covered, but in more detailed and organized very well for you to easily follow what the potential pros and cons are. I also have a great resource on how to supercharge your antidepressant. So in other words, it's full of real-world tips for making these medications work better, work faster, and help you get through your depression or your anxiety, whatever you're using it for. And hey, if you're starting this medication, chances are someone you know is also or is at least considering it. Send this video their way. It might really help them out. Starting something like Prozac can feel overwhelming, but it can also be the first step towards something better. For a lot of people, it changes everything.